I think we'll get started. We're at the top of the hour, so welcome. So many familiar faces. Good to see you all. And welcome to our KDE Hub webinar. It's entitled Mental Health Promotion Concepts and Principles, Past, Present, and Future, with our guest presenter, Dr. Katie Dowling. And welcome to everyone. My name is Alice Schmidt-Hanbidge. I'm a scientific co-director for the KDE Hub, along with my colleague, Dr. Colleen McMillan. And we welcome you here today from our team. And before we get started, I will pass it over to Colleen to do our land acknowledgement.
Thank you, Alice. So to begin, we would like to acknowledge that our team's home at Renison University College is located on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples on the Haldimand Tract, land promised to the Six Nations. Renison University College is affiliated with the University of Waterloo. Just last month, the university president publicly committed this institution to developing a better understanding of Indigenous history, building an awareness of the damaging intergenerational effects of colonialism and the residential school system, and taking responsibility for vital components of the reconciliation process. Over 400 members of our campus community joined hands in the Circle community to mark this commitment. Our team is grateful to be part of the Renison College and the University of Waterloo, and we celebrate and share institutional commitments to decolonization, indigenization, and reconciliation. Thank you.
Great, thanks, Colleen, for that. So for our focus and flow of our webinar today, just a little overview to let everyone know what will be coming. So we are going to have a presentation by Dr. Katie Dowling. There are a few housekeeping items that I'm going to talk about. We have one slide for the KDE Hub. We'll also have an interactive portion in the final 30 minutes of our webinar. And we would like to ask people, if you're interested in joining the bilingual speaking breakout room, to please let us know in the chat. And we will be having simultaneous translation for the presentation, but not for the breakout rooms. We have a specific room for the French room. So another announcement, and you've probably already seen this, is that the webinar is being recorded for future use. It will be posted on our website, and you'll be able to view it at a future time. We also always include an event brief that will be shared along with the PowerPoint slides. And also, if you can add any questions that you might have to the chat during the presentation, we won't have time for a question and answer period, but we'll also be providing written answers to common questions in the event brief that follows the webinar. So there also are some people here today who may not be as familiar with the KDE Hub. So just to give you a little bit of information about the KDE Hub. And we're a government-funded, university-based organization that aims to help mental health promotion flourish in Canada. We support connections and learning among projects from coast to coast to coast, and we're funded by the Public Health Agency of Canada and CIHR. The Hub's vision for mental health promotion in Canada is evidence-informed, sensitive to diverse contexts and culture, is equitable, and sustainable. Now, Katie Dowling, we're fortunate to have Katie join us today, and she'll share her expertise in relation to some of the foundational concepts and principles that underpin mental health promotion and explore how these concepts can be applied to practice. So Katie is a postdoctoral fellow at the KDE Hub, and we're fortunate to have her with us. And she holds an MA in health promotion and a PhD in mental health promotion from the University of Galway in Ireland.
Wow. She has a PhD from the University of Galway.
She sure is. Thank you. She previously worked at the World Health
ACM,
Organization
mental health promotion.
Center. Can everyone mute themselves, please? It's great. You're excited that Katie's here. We are too. For mental health promotion research and the School, Child and Youth Mental Health and Wellbeing Lab in Ireland, where she contributed to research, practice, and policy work to support mental health of children and young people. Katie has also delivered lectures and co-designed curriculum and training for postgrad students and community practitioners to develop their understanding of mental health promotion, concepts, theory, and practice. Katie, we're thrilled you're joining us today, and we're happy to turn the presentation over to you.
Thank you so much, Alice, for the introduction, and welcome everyone. So I'm so delighted to see so many people that are attending this webinar and so many people that have an interest in this topic area. I do know that we have people coming from diverse backgrounds with different levels of knowledge around mental health promotion. So I'm going to do my best to speak to everyone. But before I get started into the presentation, I just want to give you a brief outline of what you can expect. So the first part of the webinar is really going to look at the past. So reviewing the key concepts, theories, and frameworks for health promotion and mental health promotion. And I do want to preface by saying that a lot of these frameworks do stem from Western views of health. And we would like to acknowledge that we at the Hub recognize that there are multiple ways of knowing and doing, and that these perspectives are all valued. But today I will be presenting from Western views. Following on from the past, we'll look at the present. So this is the part that I'm really excited about. We will be looking at a key framework for health promotion, but we'll be looking at how this is actually applied to practice by featuring some of the KDE Hub project community projects. So I'm really excited for that. And then, as Alice said, in the final half hour, we will have an interactive activity where you will get the opportunity to connect with other attendees from the conference, this webinar, and be able to share ideas, experiences, and knowledge. So to start off, I want to just describe what we mean by when we say a population approach to mental health. So a population approach is one that moves beyond individually oriented clinical services, which we do know are necessary, but they're not sufficient and they're not sustainable enough on their own to really address the mental health needs of populations. So a population mental health approach really looks across the full spectrum of mental health interventions, from mental health promotion at the base. So this is really for the whole population, moving on to prevention, and then of course, treatment and recovery. So although there have been a lot of advances in terms of mental health to date, global responses to mental health still remain entirely focused on that top part of the pyramid around treatment and recovery. And far less attention and investment is paid towards mental health promotion and prevention. So if we really want to tackle the challenge of mental health at a population level, we need to embrace a comprehensive approach that's really working across these different levels of mental health intervention. So before we begin talking about mental health promotion specifically, and the frameworks associated with it, I do want to just clarify what are the main differences when we talk about mental health promotion versus prevention. So the pathogenic model, which you'll see here, it's otherwise known as the biomedical model, views health and disease and illness in a dichotomous way. So we can imagine this like two sides of a coin. In this medical view of health, a person is seen as healthy if they've avoided illness. And in the same way, if a person does not present any illness or disease, does present an illness or disease, they're no longer viewed as healthy. So this type of approach or model really views health as a goal that is only achieved if you're avoiding illness. So prevention usually takes this model where they're looking at avoiding illness, avoiding disease by reducing different risk factors. The other model, and this is the model that really underpins mental health or health promotion and mental health promotion, is the Salutogenic model. And this was developed by Aaron Antonovsky in the 70s. And this views health and illness on a continuum, which can change at different times depending on someone's circumstances, and really includes the individual, social, environmental, and economic resources and conditions that can impact on your health or mental health. So the salutogenic approach takes an asset or strengths-based approach and really looks at what keeps people healthy. So what are the causes of health rather than what are the causes of ill health? And this is a paradigm shift in comparison to that pathogenic model, which really looks at illness and disease. So here's a table that I've created that just really distinguishes the key differences between prevention and promotion. So prevention is more disease oriented and it focuses on deficits or risk factors and how to avoid or reduce these. And then on the other hand, promotion focuses on assets or protective factors for good mental health and creating conditions which nurture and maintain these. It also emphasizes this very positive and holistic view of health. So while both approaches do have different underlying concepts and theories, and they do have different starting points and aim to improve different outcomes, they still do have the same goal, which is to improve and maintain health or mental health of populations. And they also employ activities which aim to address the causes of the causes, also known as determinants. But where exactly does mental health promotion fit within a framework for mental health interventions? So the mental health intervention spectrum was designed as a prevention framework by Mrazek and Haggerty in the early 1990s. And this framework, which is depicted as a half circle, and in this image, it's the teal part of the circle. This acknowledges the importance of prevention activities in addition to treatment, maintenance, and rehabilitation. And while this framework is very important in terms of the prevention and treatment approaches, it does not include interventions focusing on promoting positive mental health. And it also doesn't show how these different interventions are linked. So following on from this framework, the circle was completed by Barry and that's the lime green that you'll see there in the early 2000s to really, where am I? There I am. To really increase our understanding of mental health promotion, given its universal relevance that everybody has mental health and we always need to aim to promote our mental health. But it also shows the link that mental health promotion affects all stages of intervention, where we're looking to really promote our mental health and quality of life. So before we continue on, I do want to just discuss what we mean when we talk about mental health and how, as mental health promotion workers, how do we define mental health from this mental health promotion lens? So some of you might be aware of the definition of health by the World Health Organization that states that health is a state of complete physical, social, and mental well-being, but not merely the absence of disease or infirmity. Of course, this is only one definition of health, and it's not the only definition of health. But I do want to highlight that second part of the definition, which is it is not the absence of disease or infirmity. You can still be healthy and be living with an illness or a disease. So this dual continuum model by Corey Keyes was developed, and it's really a contemporary view of how we see mental health and well-being. So it shows that mental health and mental illness are separate and distinct concepts. In this model, we see mental health is conceptualized as positive functioning, and it's seen as an asset and something that we can continuously cultivate and develop. So within the dual continuum model, it is divided into 4 quadrants. It's divided into 4 quadrants, and on the x-axis, that is where we see the continuum of illness. So we see high-end mental illness all the way to low mental illness. On the y-axis, that is where we see the continuum of mental health, from low mental health or poor mental health to high mental health. We can also define poor mental health as languishing and high mental health as flourishing in this model. So if a person has mental illness, it does not mean that they also have poor mental health always. And if a person is not diagnosed with a mental illness, they can still experience challenges and poor mental health. So many people with a mental illness can live rich and rewarding lives. and many people who do not have mental illness can still struggle with their mental health and require support. So when we are thinking about interventions and programs for mental health, we need to think about this model and really accessing the population across all 4 quadrants. So now I'm moving on to look at an idea that I did mention earlier, and when I talked about promotion and prevention, and that was the causes of the causes. So some of you might be very familiar with this, and we also talk about this upstream approach. But I just wanted to illustrate with a quote and what we really mean by an upstream approach. So this quote is by McKinley, who was a physician, and this was back in the 70s that he said this. And he was really highlighting this dilemma of only focusing on medical and treatment approaches to health and the importance of looking upstream. So I'll just read it out to you now. Sometimes it feels like this. There I am standing by the shore of a swiftly flowing river, and I hear the cry of a drowning man. So I jump into the river, put my arms around him, pull him to the shore, and apply artificial respiration. Just when he begins to breathe, there is another cry for help. So I jump into the river, reach him, pull him to shore, apply artificial respiration. And then just as he begins to breathe, another cry for help. So back in the river again, reaching, pulling, applying, breathing, and then another yell. Again and again, without end goes the sequence. You know, I am so busy jumping in, pulling them to shore, applying artificial respiration, that I have no time to see who is upstream, pushing them all in. So I think this is a really nice quote to illustrate what we mean by upstream approach and really looking at those determinants of health that I'll get into. So we can reflect on this in the context of mental health, because too often our response to high levels of need and demand is to call for more mental health services. And I'm in no way saying that this type of support isn't important, and of course it is, and it is still very underfunded in the healthcare system. But there's also a huge need for us to focus upstream and look at what are these causes of the causes and try to prevent these, but also promote conditions that are going to support better mental health. So we're not having to jump into the river and constantly try and save people. So a model to really, I guess, highlight what we were just talking about is the social determinants of health framework. So this framework was developed by Dahlgren and Whitehead in the early 90s to really show the interplay between the context and the complex systems that people live, grow, they work, play, and age. So this framework really helps us to shift the narrative of mental health and mental illness from an individual issue and just behaviors to something wider in terms of their social, environmental, and economic, and that it's the responsibility of these multiple levels to really improve mental health. So these different determinants translate into different risk and protective factors that can influence the mental health of individuals and population groups. And those are kind of the positives and minuses that you see around this image. So risk factors can increase the likelihood that mental health problems and mental disorders will develop. On the other hand, protective factors enhance and protect positive mental health and reduce the likelihood that a disorder will develop. We're now moving on to a framework that by the end of this webinar, I hope you will know very well, but that is the Ottawa Charter. And just to give a little bit of background, health promotion is it's not a new concept. It's a relatively new concept, but it has been around for a number of decades. So in 1986, the first international conference for health promotion was held by the World Health Organization, and that just happened to be here in Ottawa, Canada. So from this conference came the development of the Ottawa Charter, which is a vital document for health promotion and has been influential in shaping a framework or pathway for the goals and aims of health promotion, including mental health promotion. You'll see that there are 5 kind of key areas, and those are called the action areas of the Ottawa Charter. So there's building healthy public policy, strengthening community action, creating supportive environments, developing personal skills, and reorienting the health services. And we will have a chance to look into these in a bit more detail in the next few slides. This is just an image that I wanted to use to illustrate exactly how the Ottawa Charter maps onto the social determinants of health. So the Ottawa Charter is really the actions that we do to influence these different determinants and these different levels of determinants. The Ottawa Charter underscores that there needs to be collaborative action across these different action areas. There's a need for top-down policy, but there's also a need for bottom-up community engagement and action. So the most effective mental health promotion interventions are ones that include a number of different action areas or activities across these action areas for change. So moving into the first action area, this is building healthy public policy. And so this action area really recognizes that health promotion goes beyond healthcare. So when we're talking about policy, we're not just talking about health policies or mental health policies. It really puts it on the agenda of all policymakers across all sectors and all levels, and really makes them think, how are their decisions, how will this impact on health or mental health? So when we talk about different policies, we could be talking about housing, education, employment, transport, childcare, the list goes on, but it's really about thinking about all of these different policies that are being made and considering how is this going to impact health. The next action area is reorienting the health services, and this action area, it probably out of the 5 has received the least attention. And I'm sure you can probably, once I describe it, guess why. But this action area proposes that it's not, the role of the health sector is not just for curative and treatment approaches. They really need to move towards this prevention and promotion approaches as well. And that the healthcare system needs to contribute to the pursuit of health for all. So it is a challenge, but it is something that we are working towards. So it's about developing the capacity of health systems and programs to achieve population mental health and greater health equity, and enabling all people, whether they're sick or well, to move along this health illness continuum in the direction of health. It's also about health services expanding their awareness and their sensitivity and respect to cultural needs of different communities and populations. The third action area is creating supportive environments. And this action area is really about developing the physical and or the social environments in which people live to support their life. So physical environments can include the natural and built environments, and social environments are more those psychosocial, economic, and cultural environments. So by creating a supportive environments, we're moving mental health beyond this individual focus and really considering, well, how are the settings in which people live, how are the environments around people impacting on their health? The fourth action area is strengthening community action. And this action area is really all about expanding the resources and capacity of communities through their active engagement and participation, so that they are responsible for identifying their needs, setting priorities, and taking collective action about things that are around their own health and taking control over their own health. So really at the heart of this action area is empowerment principles. So this is all about empowering communities to take ownership and control of their own lives and their own destiny. And the final action area is developing personal skills. And this action area is all about developing the skills and capacity of people to assess their health needs and to really exercise more control over their own health. And as well as the health of others and their environments. So if we're thinking about this from mental health promotion, this can look at developing social and emotional skills such as self-esteem, self-awareness, resilience, coping skills. And also it can relate to mental health literacy. So improving people's understanding of what mental health is, how do we identify it, and how do we look out for it? Okay, so we're moving on to the second part of the presentation, which I said is the part I'm excited about. And this is when we get to explore the Ottawa Charter by highlighting and illustrating some of the KDE Hub project community and how they are already successfully implementing activities across these different action areas. I just want to say that the KDE Hub part of the community of the Acadia Hub projects supports 61 different projects. So of course, it wasn't possible to include all of these, but there are some really fantastic projects. And if you are interested in learning more, please visit the Acadia website and you can learn about them, and you can link onto the project's websites as well. So also, just to say, this is a whistle-stop tour of the projects, but we will be providing links in the chat if you wish to learn more about these. Please also feel free to reach out to the Hub if you'd like to learn more, and we can connect you with the projects. And lastly, the projects that I am highlighting today, I've selected them to illustrate one of the 5 key action areas. But you might notice when I do talk about these projects that some of their activities cross over into other action areas. And this is actually fantastic, because this is what we strive for in health promotion and mental health promotion, to have change across different action areas. But for the purpose of this presentation, I'll be focusing solely on one action area for each project. All right, so the first project that I want to talk about is Agenda Gap. And this is led by the University of British Columbia. And we're right now with red. I have color coded things. So red, we're talking about building healthy public policy. So the aim of Agenda Gap is to equip youth ages 15 to 25 years to develop and lead action plans and to contribute to policies that strengthen their mental health and well-being for individuals and their communities. So in line with this action area of building healthy public policy, this project uses youth-engaged policy-making approach, which aims to improve the social and structural conditions that impact on youth mental health through intersectoral and multi-level policy change. So it really puts youth at the center and aims to bridge the gap and that disconnect that youth often feel when it comes to creating change at a policy level. So if they want to be part of the change for their own quality of life and well-being. Just to say, I have a note there at the bottom of the slide with a star, that the Agenda Gap are actively seeking communities across Canada to develop vested partnerships, and they'd like to expand Agenda Gap to other communities. So if you are interested, reach out to Agenda Gap directly, or you can reach out to the Hub and we can connect you. The next example that falls under this action area of building healthy public policy is the policy work of Away Home Canada. So Away Home Canada is a national coalition that focuses on solutions to youth homelessness through transformations in policy, planning, and practice. They do really important policy work and investment that enables a shift away from just managing the problem of youth homelessness through emergency services, and really focuses on that upstream approach that we were just talking about, to focus on prevention and promotion of the determinants of mental health. So they do this by reaching different policy and advocating for different policy changes across various sectors, including child protection, training, justice and corrections, health, education, and housing, to name a few. So while the policy work of this organization is not part of the Acadia Hub project community, Away Home does have a project called Family and Natural Supports, and this is part of the Acadia Hub community. This project seeks to strengthen youth's relationships with their family and other natural supports and meaningful adults in their lives to help them move forward and transition into adulthood. So this specific project that I'm talking about is actually a very good example of creating supportive social environments. But we wanted to focus on Away Home Canada in terms of policy, but this is another great initiative that they're doing for another action area. We're moving on to purple now, and this is reorienting the health services. So that is the action area. And I want to talk about this project called Social Prescribing for Better Mental Health, which is led by the Ontario Alliance for Healthier Communities. So if you remember back when we talked about reorienting the health services, this is all about moving the healthcare system to focus more on holistically on the individual and focusing more on those promotion and prevention approaches. So the aim of this project is to enhance the capacity and improve mental health in communities through social prescribing. So for those of you that aren't aware of what social prescribing is, it's an activity that really bridges the gap between clinical and social care by referring patients. So if patients go, into health services, it refers them outwards to non-clinical services that are chosen according to clients' interests, goals, and needs. So in line with this action area of reorienting the health services, this project takes an assets-based and holistic approach and recognizes there's a need for healthcare to move beyond just treating illness alone. And it really focuses on those social determinants of health and how can you link people back in with their communities so that they can improve their health and mental health. The other project under Reorienting the Health Services is Enhancement of Youth Case Management with Peer Support and Indigenous Cultural Engagement. And this is led by the Alexandra Community Health Centre, also known as the ALEX, which is located in Calgary. So the ALEX is a hub that has integrated, comprehensive, and accessible supports and outreach services for people, particularly those that are experiencing health and social issues, such as poverty, trauma, social isolation. So in addition to the treatment and the health services that are offered here at this center, they also support youth in managing wider social determinants of health. So they'll help them with housing, justice navigation, food security. They have support groups for parenting and for 2S LGBTQI+ individuals. They also provide pre-employment training. So you can see how all of these activities are really impacting on those wider social determinants of health. And it's a really great example of that upstream approach. This specific project is looking to adapt what's already happening to make it more relevant for Indigenous youth. And the reason for that is that the center recognized that 1/3 of the youth that were accessing the service were Indigenous, but they found that the services and offerings that were provided weren't, they didn't include the needs of Indigenous youth. So really what they're doing right now is looking at how they can make the services more appropriate for the youth that are accessing it. So one of the things that they're doing is they're contracting elders to provide more Indigenous cultural supports and teachings. And they're also integrating peer support into the existing youth case management team. So this is a really good example, again, of how this health services are becoming more supportive and aware and respectful of the different cultures and needs of the communities they work with. So we're moving on to green, and this action area is creating supportive environments. And the project and just as a reminder, this action area focuses on developing the physical and or social environments that support health. So this project is the Inusivik Community Wellness Hub, and this is led by the Kalyigiartit Health Research Center in Nunavut. And the aim of this project really is to bring together the existing programs within the community into an integrated and holistic hub, community-led hub and service delivery model. And so the reason for this was that they were finding that people within the community, Indigenous people within the community were finding it hard to access these services because of barriers. So they wanted to have this service hub that offered a number of different services in one location. So things like land-based programs, counseling services, early childhood programs, there's the research center, maternal child health programs, the list goes on. But it's really all about that physical space and creating a physical environment that's supportive of mental health. And just to say, they were very intentional about how they went about designing this physical space, consulting with people within the community and making sure that the building itself, the form, the use, the cultural expression was really reflected in the building. So I think that's a really good example of the physical environment and creating that physical environment. So now we're moving on, we're still in creating supportive environments, but we're looking at it through that social environment lens. And this project is called the Friendly Calls Program, and it's by the Canadian Red Cross. And this project really focused, the intervention provides supportive listening, social interaction, and psychosocial support for older adults or those who might benefit from a friendly call. And this is really to reduce anxiety, depression, or loneliness, and really just build those connections and increase people's well-being. So they're looking to, so the current project is seeking to expand the program to bridge social distancing, build social connection, and prevent isolation, especially as kind of following on from COVID and the pandemic. So again, this is a great example of the social environment being built. And the final project within this action area is Healing Through Relationships by the Canadian Mothercraft Society. And so I've already done physical, I've done social, but this project actually taps into both the social environment and the physical environment. So this specific project aims to improve the mental health and well-being of mothers of young children who have experienced trauma, as well as their young children aged 0 to 6 years. So the project hopes to achieve this in two main ways. So the first one, which is more of the physical environment, is providing a wraparound community-based model to decrease isolation and provide more in-person services and access to these services situated in one location. So again, this is reducing the physical barriers and the infrastructure gaps by providing this all in one space. The second approach that they use is that they offer an 8-week parenting intervention to improve the relationship capacity of mothers and promote secure attachment, with the hope that this is going to improve the mental health and well-being of the children. So by strengthening that social relationship between the mother and their child, it's really looking to promote well-being for both individuals. So we're moving on to the fourth action area, and this is strengthening community action. And as a reminder, this is really what I said before about empowerment, leveraging community assets and resources, and supporting communities to take collective action over their own health. So the first project I'd like to talk about is Celebrating Culture, Celebrating Life. And this is led by the Multicultural Health Brokers Cooperative in Edmonton, Alberta. So this project aims to help newcomers and culturally minority youth, 13 to 19 years, better connect with their family's culture and access resources and supports within the community. So the project engages a team of youth-oriented brokers from the community who help other youth express their experiences and focus on their strengths. So these youth brokers offer a number of different types of support, including one-to-one support, small group development, building community capacity to create change. They create relationships with institutions to build cultural competence and awareness. And they also provide opportunities to change and inform policy, practice, and programs through the voices of lived experiences and advocacy work. So this, like I said, is a great example of how they're leveraging the existing resources in the community and allowing people to take collective action. And they recognize that youth brokers really have this unique understanding of the diverse life experiences, languages, and cultures of communities, and can really empower other youth to take action. And the second, we're getting there, but the second project is community-centered responses to 2S LGBTQ plus COVID-19 mental health impacts. And this is led by the Community-Based Research Center. So again, we're talking about this strengthening community action. So this project aims to achieve a number of objectives, but I will just be speaking to one specific core objective, and that's they want to adapt and deliver the existing investigators program. So this investigators program is a participatory, community-based, and capacity-building intervention for 2S LGBTQI+ individuals who are interested in health research, but also want to enhance the mental health and the knowledge and capacity of themselves and their peers and their communities. So within the training for this project, participants learn how to conduct community-based research and how to develop and deliver mental health promotion interventions to address the mental health needs and experiences of their peers. So they are really, this is again, a great example of strengthening community action where they are leading. So through participation in every step of the research process, program participants are empowered to develop knowledge about queer health, have opportunities to connect with other queer people in their communities, and develop community-based research skills they need to be health leaders in their communities, and really be part of the design of interventions that are important to them. We're moving on to the very last action area. And this is developing personal skills. And as a reminder, this action area is really about developing the capacity and skills of individuals to exercise more control over their own health. So the first project is the Theatre for Positive Mental Health by the led by the Moyo Healthcare and Community Services, and they serve the Peel region in Ontario. And this project is really, it uses a participatory theatre approach to promote healthy lifestyles and coping skills, and also to raise awareness of emotional and psychological well-being for Black Canadians in the community. So participants get together and they participate in a 6 to 8 week block. And this is where through theater, they develop stories, narratives, and monologues, which help them address the unique social determinants that affect Black populations. So through this theater program, I've already named off a number of skills that they're aiming to address, including mental health literacy and coping skills. And the overall aim of this project is then to help reduce stigma in the community, but also increase help-seeking behaviors. The second project in this action area is I Can Help, improving mental health literacy of sports coaches in diverse communities across Canada. And this is led by the Coaching Association of Canada. And the aim of this project is to increase mental health literacy among coaches, teachers, and community support leaders, especially those that are working with hard to reach communities. So Indigenous, remote, newcomers, socioeconomically disadvantaged. And they're looking to really adapt the resources to be more culturally and trauma informed. And they hope in doing this, that this will also not only improve the health of the mental health of coaches, but also improve the functioning, performance, and mental health of those that interact with coaches. So the organization recognizes that many coaches are on the front line of mental health crisis, but as well, many feel unprepared or ill-equipped to deal with this. So these resources have been developed to equip coaches with the mental health literacy skills they need, not only to focus on their own self-care, but also to support sporting participants. And we're on to the very final project, and this is Connect, supporting birth, kinship, and foster parents. And this is led by the Adolescent Health Lab at Simon Fraser University. So the aim of this project is to support caregivers to gain in-depth knowledge about the complex trauma and attachment of the young people that are in their care, and develop strength-based skills to promote youth mental health and secure attachment. So by doing this, the project really aims to reduce caregiver stress and increase their caregiving satisfaction and mental health. And also, in turn, they hope that this will improve the mental health and well-beings of adolescents in their care through building attachment security, resilience, and decreasing emotional and behavioral problems. And also, this project aims to develop practitioners' skills that work with these caregivers in training and supporting them. So this project is actually threefold in terms of there's three kind of stakeholders. We have the adolescents, caregivers, and the mental health practitioners that they're working to develop their skills. All right, so we are now at the stage of the interactive activity. And like I said, you should know hopefully you will know the Ottawa Charter by the end of this webinar, because a lot of this activity will focus around the Ottawa Charter or anything else that you possibly learned today. So the next 30 minutes will provide time and opportunity for you all to reflect, connect, and discuss your ideas around today's webinar, and maybe how you might apply some of these learnings to your own area of work or even your own life. As a reminder, we do have one bilingual breakout room, and it has a capacity of about 7 to 8 people. So if you would like to be added to this room, please let us know now through the chat if you haven't already done so, and we can accommodate this. So this activity is called the 3 W's, and it's based on the what, so what, and now what. The first part of the activity, you will get to discuss the what in terms of what have you learned from the webinar today. And then in the second half, the part 2 and 3 will be so what? So why is this important? What have you learned that is important to your work? And then now what? How can you further apply some of the learnings to your own work? So I just want to thank you all for attending this presentation, and especially thank the people that have stuck around for the interactive piece. Like I said, I hope that you found value in participating in that. As we mentioned before, there wasn't time to really allot time to prepare for questions and answers. But if there were questions in the chat, or if you do have any questions afterwards, or if you want to send them into the chat now, we will be creating an event brief that we will send out after this webinar, and I can answer any of those questions there. Or you can reach out to me directly. My email would be on the very final slide. You can reach out to myself, or if it's more related to the projects, you can reach out to the hub email address, and we'd be happy to answer them for you. So I do want to conclude with a final 2 slides from myself, and this is just about some of the things that are happening with KDE Hub and just looking ahead. So for those of you that don't know, the KDE Hub does support mental health promotion, knowledge development, and exchange across the different projects that we support, but also the wider mental health promotion community. So we're always looking for ways to really improve that knowledge development. So we do have 2 upcoming studies that we'd like to inform you about. And the first one, I am actually leading this study, and this isn't live at the moment, but it will be kicking off in June, and it will be a needs assessment study to determine the implementation and evaluation capacity needs of the KDE Hub project community. So the participants we're looking for are those that are involved in the MHPIF, MHCOVID, or MIGHTY funding streams. And data will be collected through an online survey that will take about 10 to 15 minutes to complete, and that's the only ask, and it will be anonymous as well. And this will be used to inform the development of a number of tools, including an online self-paced course that we're hoping to develop to really access those needs that have been identified and support you in that way. So we'll be in contact via email with more information on that study. And the second study, which is actually currently live, and if you'd like to participate, you can scan the QR code, and also within the chat, we'll be sharing the link that you can access right away. And this study doesn't take as long as 10 to 15 minutes. It's only a few minutes of your time. And the purpose of this is to better understand what momentum looks like for the field of mental health promotion in Canada. So really, you'll be looking at, it's a concept mapping study, and you'll be invited to really think about what resources and actions are needed in order to create and sustain momentum in your work or the field of mental health promotion. This is open to everyone, so you don't have to be part of the KDE Hub project community. So if you are interested in participating, either scan the QR code or click the link provided. And I will turn it over to Alice and Colleen to close.
There we go. Yeah, thank you, Katie. That was a wonderfully comprehensive overview of the spectrum of mental health promotion concepts and principles. And, you know, your presentation was accessible, it was practical, and regardless of where one positions themselves in the mental health landscape. As Alice mentioned at the beginning, if you're learning about the hub, we welcome you to visit our website. And of course, you can follow us on Twitter. And if you would like to connect with Katie directly, I know she would welcome that as well. So please do so by either her email address or of course Twitter as well. So thank you to each of you for joining us this afternoon, and we look forward to when we can meet again. Enjoy the rest of your day.
Take care, everyone. Thank you.
Bye-bye.